Good evening, Dr. Pankaj. I am Dr. Niharika Virkar. I am an orthopedic surgeon currently pursuing hand and reconstructive microsurgery under Dr. Parag Lad. Let me introduce our guest of honor for today, Dr. Pankaj Ahire. Dr. Ahire is a senior hand consultant practicing in Mumbai for over 25 years. He is the organizing chairman for the forthcoming conference. He is also the president for the APFSSH and he is in the EC committee for this same forthcoming conference, which is APFSSH. So currently the APFSSH is generating a lot of buzz and it is scheduled to be held in Mumbai after a span of almost 25 years. So could you tell us a little bit about the APFSSH?
Yeah, in fact, whenever I spoke about APFSSH 2025 to some of my colleagues, the first question that came up was, what is APFSSH? And it was very natural that they did not know about it because unlike other associations or organizations, say like ISSH, which is Indian Society for Surgery of the Hand, or BOS, which is an association of members, whereas APFSSH, as it stands, Asian Pacific Federation for Societies for Surgery of the Hand. That is a federation of national hand societies of all the countries in the Asian Pacific region. And it currently has about 17 members. So that's what APFSSH is. It's a federation or a representation of hand surgery associations from the Asian Pacific region.
Right, sir. So does that mean that this year we will have both conferences, the APFSSH as well as the ISHCON?
No, we will not, because as a host society, we will have our National Hand Society meeting, which is the ISHCON, as a part of APFSSH conference. It will not be a full-fledged ISHCON because ISHCON normally runs for around 2.5 days, whereas the APFSSH itself runs for about 4 days. We can't have a 6.5 days of conference. However, there are certain prestigious and mandatory sessions of ISHCON, like Professor R. Venkateswamy Oration, Professor B.B. Joshi Oration, then there is Innovation Award, and then there is Emperor Ashoka Award. All these prestigious parts of our national meeting, which is ISHCON, will be held during APFSSH. The advantage is, for this prestigious event, we will now have audience even from the APFSSH. Whereas the presenters in the Innovation Award, which are essentially mid-level or young-level surgeons, will have audience from all over Asian Pacific region, which otherwise would not happen.
Yes.
So I think it's a win-win situation to combine both the meetings.
Yes, sir. It's especially for young budding surgeons like myself.
Sure. It's going to be a very big platform for a lot of people because we expect around 700 to 800 hand surgeons from all over Asian Pacific region, not only Asian Pacific region, but from the rest of the world as invited faculty to come. It's a great opportunity for networking, and as you grow in the specialty or any specialty, you will realize that networking is an extremely important part of growing as a surgeon.
Yes, sir. So I always thought that a conference of this magnitude is meant for established surgeons who will be attending the conference from various parts of the world. So do you think it would be advisable for a young surgeon like myself or my colleagues to attend this conference?
Not advisable, I would very strongly recommend. This is one opportunity where a young surgeon can meet who's who of hand surgery from across the world. Most of the conferences, national conferences, tend to get dedicated to 2 or 3 broad topics. Say there will be a conference which will have more weightage for microsurgery and nerve surgery. There might be another conference which will have more weightage towards soft tissue trauma and fracture fixation. There will be another one where elbow and wrist may be discussed. This will be one place where each of these things and more will be discussed by presenters who will vary in seniority from trainees to absolute stalwarts in the field. So this is a great opportunity for young people to not only learn but also just simply meet people and explore future opportunities.
Right. So does that mean that there will also be some sort of fellowship opportunities in terms of attending this conference?
Yeah, I saw a little bit of sparkle in your eyes when you uttered fellowship opportunities. Yeah, I think fellowships are an important part of any subspecialty training. Though there are no programmed fellowship interviews in this conference, and there are none usually in most of these conferences, you will notice that most of the fellowship directors or fellowship guides from across the Asian Pacific region or even from outside will be present in this conference. And just like a student or a young surgeon like you is looking for opportunity to train abroad, there are people who are looking for trainees to pick up from India. So it's a win-win situation for both the trainer and the trainee. So while there are no designed opportunities, I'm sure a good talent will be spotted and picked up. And there is obviously no harm in approaching a senior person and say what's there in your mind. The worst answer that you can ever get is a no, and it doesn't harm anyone.
Yes, sir. That's good to know. So after I've begun my training in hand surgery, I've realized that there is an array of subspecialties in hand surgery like wrist or the finger trauma. There's also microsurgery, reconstructive surgery. So will the conference have separate sections to focus on each of these specialties?
Yeah. So let me answer this in two parts. Hand is not a subspecialty. Hand is a very broad specialty which has subspecialties like you mentioned. And I don't think there is any other specialty in orthopedics, be it arthroscopy or arthroplasty or spine or whatever, which has so many subspecialties like hand surgery has. Will the conference do justice to all the subspecialties of hand surgery? Yes, by all means. In fact, the conference will run in 4 halls simultaneously, of which one hall dedicated to hand therapy. One hall on all 4 days will cover elbow and wrist surgery, because Asian Pacific Wrist Association, which is again a member-based association of wrist surgeons in the Asia Pacific region, is holding its 10th annual conference as a part of APFSSH. So again, who's who of wrist surgery will be there. Remaining 2 halls, total 16 sessions of approximately 3 to 4 hours each, are dedicated to congenital hand, those part of wrist which are not covered in APWA sessions, then microsurgery, nerve surgery, and the theme of the conference. A large part of the program across all 4 halls will also focus on progress with purpose. Progress with purpose is a very thoughtful theme that we brought in for this conference, and we are very glad to let you know that a lot of overseas speakers have expressed their desire to label their talk as progress with purpose. So that is how appealing the talks are going to be. It is not going to be talk of I operated on 10 patients and 4 did well and 6 did excellently. People are going to give a much broader and impactful presentation which will be aligned with our theme of progress with purpose.
Right, so it's good to know that the conference is going to be academically so comprehensive.
It will be. It will be much more than you think.
So could you please briefly tell us how this forthcoming conference would be different from our national conferences that are regularly held, like the ISHCON or the Plastic Surgery Conference, the Microsurgery Conference?
So when a National Hand Society holds its conference, say like ISHCON or say any other microsurgery conference, a lot of things that are discussed are related to the geography of the surgeons where they come from. So for example, we probably will never land up discussing elbow arthroplasty or a wrist arthroplasty,
Yes.
or there will not be a very heavy weightage on wrist arthroscopy, because these procedures happen with less frequency in our setup. Another big area which almost never lands up getting discussed adequately in most of the hand meetings in India are rheumatoid disease and its treatments. So an international conference like this, why do we want to put in so much effort to hold an international conference? Is because the other countries, the other regions, the other institutes might be doing work which we are not doing here, and it is not that we do not have place for that work here. If you go by the last statistics, there are approximately 14,100,000 patients waiting for a PIP joint replacement in India. That's how big a problem is, but we'll end up not doing it because nobody has been doing it with that frequency and we feel it is not required. What these experts who come from outside the country and speak to us, they don't teach, they show us the possibilities.
Yes.
And when they show us the possibilities, we should seek more training and convert those possibilities into realities here. That's the purpose of these conferences.
Yes, sir. So I had a few more conference related questions. So does this conference happen every year? That was one. And secondly, why Mumbai?
So APFSSH conference happens once every 2 years. The last time it was held in Singapore in 2023, and now we are holding it in Mumbai in 2025. Good question, why Mumbai? The host is India. It could have been held anywhere in any city in the country. The reason it is being held in Mumbai is great connectivity for Mumbai. Since I am the president of ISSH this year, it was probably a natural choice that if I am going to be part of the organizing committee of APFSSH, we'll be more comfortable holding it in Mumbai. Mumbai, you will be surprised, is probably one of the most cost-effective venues to hold a conference like this. We did explore other cities. We went ahead with negotiations in other cities, but eventually found that Mumbai had the best bet in terms of connectivity, cost, and the number of flights that are available. It's not only the flight being available, the number of flights that people have available, so they can enter and leave the city at different times. So that optimizes the time that they invest in the conference. That also is an important part because all of us are working professionals. So that's why Mumbai.
Okay, sir. So while trying to register for this forthcoming conference, there was a section which asked whether we are a member of the APFSSH. So is it necessary to be a member of this organization in order to register for this conference? And are there any benefits of being a member of this organization?
Okay, so there are no special discounts. The reason your registration page asks you whether you are a member of APFSSH, and there it explains what is meant by being a member of APFSSH. That is, if you are a member of your National Hand Society, then you are a member of APFSSH. The reason we are collecting this data is we want to know how many members from which hand society are attending. And this is just not data mining. This is about identifying the areas of need. For example, if you find that only 5 people from Sri Lankan Hand Society attended, then it is a responsibility of APFSSH to reach out to these societies and find out why there is less participation. Does the society need any help to propagate hand surgery in that country? So for that, these numbers are important. In terms of any special discounts, if you simply compare the registration rates of what we have floated for this conference and compare them with any previous APFSSH meetings, say even if you discount for inflation, just consider for last 5 years, we still have the cheapest rates of registration. This we have done with the sole purpose of attracting more trainees, because that's where I think the pool which will take the association forward lies. The seniors will come, the seniors will have money to register. It's the trainees who might find it a bit expensive to travel out of their country to attend a conference, and the least we could do is keep the registration fee at its lowest. This is the lowest registration fee in many years for APFSSH.
Yes, sir. So you've told us so much about this conference. So can you please also tell us where the conference will be held, when it is going to be held, and how do I register for this conference?
Okay, the conference will be held from 10th of September to 13th of September. Timelines when it begins on 10th and when it ends on 13th is available on conference website, which is APFSSH2025.com. Though the conference starts on 10th, unlike most of the conferences which start around lunchtime, we'll be starting at 8 o'clock in the morning on 10th. So for all practical purposes, the conference starts on the 9th evening, and that's when we will have the faculty coming in. We might have a workshop on 9th evening for a select 30 to 40 people. And we hope to end at 2 o'clock. And keeping in keeping with the reputation of the conferences that are generally held in Mumbai, we will finish Torrent time at 2 o'clock on 13th. The conference will be held at the Westin, Mumbai Powai Lake, one of the most sought after venues for meetings in Mumbai. Has excellent halls, fantastic rooms, one of the best food a 5-star can offer in Mumbai, and 600 rooms to accommodate any number of delegates that would want to come for this meeting. Once you go on the website, almost all the information is available, and our contact numbers as well as email addresses are there on the website. If there is any information that you need, just pick up the phone, dial, message or email.
Okay, sir. I think I would like to encourage all my young colleagues to register for this conference because I think it's going to be an academic feast. Thank you.